What's going on, everyone? Welcome to today's pandemic update for Tuesday, April 18th, 2023. The big headline for today: the FDA has authorized a second dose of the updated COVID booster for older adults. This is the bivalent booster. Remember that booster that most who watch this update daily probably had late last year? Well, you can now get a second dose if you're over 65. And let's continue to scroll down here. Also, people who are immune compromised, says here, most people who are immune compromised can get an additional dose at least 2 months after their last dose, according to the agency. If you do not know what immune compromised means, people who have long-term illness, such as asthma, there's a long list, but quite frankly, we can consider people who have long COVID immune compromised, because you're dealing with shortness of breath, fatigue, tiredness. You're considered immune compromised, and I assume many of you who are dealing with that will go out there and try and get a second dose. I know a lot of people, they really have wanted this. Those who are hardcore people that still take this seriously, like they should, they want to get a second dose. I personally, I'm ready for a second dose. I haven't had one since September of last year, so I think it's time. So I'll see if I can get one. I'll talk to my doctor. I'll talk to the pharmacy, and hopefully I can get one. All right, moving on here. We have a lot of news to get through today. I saw this last night. Remember the TV show Everybody Loves Raymond? Well, one of the key stars, Ray Romano's, had a terrifying health scare. I had an almost completely blocked artery in my heart, is what the headline says here. And you come to scroll down here, and it says here, the actor revealed his doctor told him he was at risk of a widowmaker heart attack due to a 90% blocked artery in his heart. He ended up undergoing a procedure to prevent it from happening and described the experience as lucky. I had to have a stent put in, told Ray Romano told Mark Maroon on his latest episode of, we won't say what that is, but it's a podcast. I got kind of lucky that we found it before having a heart attack. So yeah, scary. I don't know if Ray Romano tested positive for COVID. It's something that can be looked up. I don't recall seeing him say that he's had COVID, but maybe he had it and did not publicly disclose of it. All right, here's more updated actor in celebrity news. Jamie Foxx remains hospitalized in Georgia as he undergoes more tests after medical complication. So he is still undergoing more testing, and he was supposed to be starring in a role of a new show in his upcoming Netflix movie, Back in Action. And I have read they have a look-alike actor that looks just like Jamie Foxx now filling in for him. So the show must go on despite him being hospitalized. All right, moving on to this. I thought this was rather interesting and concerning too, because I bet they're not the only company doing this. The CEO of Congra, maker of Slim Jims. Have you ever had Slim Jims? Yeah, Slim Jims and Bird's Eye Vegetable. I did not know Slim Jims and Bird's Eye Vegetables were made by the same company. So you have processed Slim Jims, then you have vegetables being made. So you have unhealthy food being made by the same company that's making healthy food. Who would have not thought? Admitted on an investor call that the company is using COVID as an excuse to permanently raise prices. That is just utterly ridiculous. And it goes on. This quarter, the company posted profits nearly 60% higher than the same time last year. That is just downright disgusting. They should not be using the pandemic as a way to make more money for their company, so executives, CEOs, and whoever can take a nice big profit and buy another mansion. I'm sorry, this is a crisis and you should not be using it to make a huge lump sum of money. It's ridiculous. They're basically taking advantage of people. And this was tweeted by the More Perfect Union. All right, we have more news. This is not good news. Prior COVID-19 infection increases risk for incident diabetes by 17%. So your risk of getting diabetes if you had a positive case of COVID goes up by 17%. Yikes, that's rather alarming, don't you think? But here we are, everything's wide open. Oh, it's just the flu now. It's not that big of a deal anymore. We beat COVID-19. No, we did not beat COVID-19. As long as people are still being infected, as long as people are still dying, COVID-19 is still real and it still carries on. First off, the deaths are bad. Second off, getting infected, you are at risk of a whole array of different things, including what you see here, diabetes. All right, moving on to India for today. And today in India, they added another 7,633 new cases. And they also added some more deaths today. Where's the death toll? They had 11 new deaths added today. And then you come over to this. Delhi. This is a state in India, or a place in India. Delhi sees surge in COVID-19 cases. 430% jump in active cases in just under 3 weeks. Wow, that's a really big rise, and that should be of concern to you, because XBB 116 is something we're going to have to deal with sooner or later, probably as we head into the start of summer. I'm concerned at this point because it's running so late with our spring wave. We're not really having one. I'm concerned our next wave will be timed perfectly with the Memorial Day weekend holiday. It's a wild card possibility, and it's also possible it comes before that. We don't know when it's going to come, but it is going to come. Whenever India sees a new wave, or whenever there's a new variant out there is what I'm trying to say, sooner or later we have a wave of some sort. Who knows how big it will be? We'll probably never see the true scale of it because data is just so hard at this rate. It's just horrible. All right, this day in COVID history, April 18th, 2022. CDC's mask mandate for indoor public transportation is struck down by a judge in Florida. I remember this day very well. I was extremely disappointed. And guess what? We have seen studies that have shown a high percentage of flights have COVID aboard the flights. So guess what? Masking should have never ended on public transportation, especially on airlines. Airlines are basically the main way, aside from cruise ships, that a new variant that forms in another country makes its way over to our country. And hello, this is how the XBB 116 variant has gotten here. Now I get it, masking does not end all cases, but it does cut down a large number of cases, and it's something we need to bring back, but I'm just preaching to the choir on that one because it's not going to happen. Alright, taking a look at wastewater here. Did not get much in the way of updates from wastewater. It's generally a mixed variety of readings across the country. That's all I can say about it. We tend to get the most updated amount of sites towards the end of the week, and the beginning of the week the trend is now a lot of sites get grayed out, unfortunately. Alright, taking a look at the CDC transmission map. 768 counties are at high, 508 are at substantial, 1,412 are at moderate, which is the dominant amount across the country. Low is at 426. So again, we're continuing to see high and substantial transmission drop, and we're seeing moderate transmission increase, which again, no, it's not perfect or good because the transmission is still occurring, but it's better than seeing higher substantial increase. We'll see how much longer it lasts because XBB 116 is coming. Here's the latest variants. XBB 15 is at 78%. XBB 116 that's at 7.2%. XBB 191 is at 6.5%. XBB 192 is at 2.5%. XBB 151 is at 2.4%. FD2, which I think is going to be a dead-end variant, is at 1.7%. And BQ 1.1 is at 1%. I say FD.2 is going to be a dead-end variant. There's always the possibility that it merges with some other variant, or it branches off into something of its own that becomes concerning. But I think it's safe to say XBB 116 eventually will be the one that we really need to pay close attention to. Alright, New Jersey, 636 new cases today. Probable cases, 109. Lab confirmed deaths is 3. Hospital reported deaths is 4. So I'm assuming they're separate. So that would make 7 deaths today if they're separate. But taking a look at New York State, 535 new cases today. Again, their cases are This is the lowest. These are the lowest levels we've seen in New York State in a really long time. I know we missed reinfections with this. I know we missed the at-home testing, but still, for PCR testing, this is some low levels. Positivity rate, 1.7%. 7-day average, 1.8%. And the 1.7% is much higher than yesterday's percentage, which was below 1%. Take a look at hospitalizations in New York State. 822 people in the hospital. 112 people in the ICU. New York City does report today, and they had 247 people in the hospital, 40 patients in the ICU. All right, BNO over the last 24 hours reports another 9,694 cases. The average is now 14,966. That's continuing to drop. That's down by 216, which is fantastic news. States reporting 6 out of 50. Not many states usually do report on Monday. We'll see much more from today's report, and tomorrow, not tomorrow's video, but Thursday's video, we'll see about 25 from Wednesday's update. In hospital, 15,428. That's down by 662. We expect in tomorrow's update to see a slight rise, either slight rise or flat, and definitely when I do my video on Thursday, we'll definitely probably see an increase. In the ICU, 2,091, that's down by 40. New deaths, just 77. Average deaths, 202, that is up by 1. So overall, that is flat. Yes, yet again, no Walgreens. Let's take a look at some international data, shall we? And we'll just only do a few states here, because I know this video is running behind today. And, let's start off with this first. Vietnam, 761% increase in cases. That's really concerning. 4,244 in the last 7 days. The previous 7 days before that only had 493. So, yes, Vietnam is seeing a quick rise in cases. And let's come up here to Australia, down 38% on cases, down 30% on deaths. France, cases are still rising. They're now up 19% on cases, up 38% on deaths. India, 71% increase on cases, 54% increase on deaths. I do know today's cases were low again. I expect the next 2 to 3 days, India will probably report higher cases. If not, we have to start looking to say, hey, maybe India is starting to get near the top of this XBB.1.16 wave. And if that were to be true, that would prove XBB.1.16 wave is a very quick one. I'm not convinced yet. It's far too early to call a peak. I don't want to be like our peakologist in this country, Scott Gottlieb. I haven't even checked in with him in a while, because he's always quick to call peak. He said COVID was over 2 years ago, and, well, here we are. I'm still doing these videos, aren't I? New Zealand saw a 17% increase in cases, and their deaths are up 3%, and let's just end it on Mexico. 36% increase in cases, 61% increase on deaths. That's concerning. Alrighty, that does it for today's pandemic update. We will have another pandemic update again tomorrow. Don't really have anything special planned for tomorrow, but you never know when a study is going to come out that I want to do a full deep dive on, so stay tuned. Until I see you all again next time, I will see you again next time. Until I do, test negative, not positive, stay safe, hit like if you like this video, and if you want to see more updates on all the various news of the day or the data revolving around the pandemic or celebrity health, hit the subscribe button down below. See you all again next time. Have a great night, folks.